The purpose of this presentation is to strengthening clinical reasoning for safe patient-centered respiratory care through real situations. Miss Masters' principal diagnosis is COPD, and she has an oxygen concentrator in her home. And you have been asked to assess her condition and make recommendation for additional therapy. When you arrive, you find that she has oxygen concentrator in her room, and what of the following here you will assess. Blood pressure is not crucial, but it was 110 over 60. Temperature is not taken. Patient is alert and oriented. Patient appears to be awake and cactic and cactic. Peak flow is not obtained, not appropriate. Breath sounds are diminished throughout with the crackles on inspiration. There is no peripheral edema, and the heart rate was 102 breaths per minute. The patient has loose, non-productive cough. Oxygen saturation was 92% on 2-liter nasal cannula. Chest expansion equal, and breath sounds decreased in the basin. Respiratory rate is 24 breaths per minute, and the patient is ambulatory, but she sleeps much of the time. Current medication: Lasix, Vanoxine, Theodore, Ativan, and Atrovent via MDI. The compliance appears to be good, although her inhaler technique is poor. In the basis of your assessment, what recommendation of the following you have in front of you would you recommend? Uh, First, nocturnal oxygen study is not necessary. Also, ABGs is not necessary. Nasotracheal suctioning is not necessary and could be even dangerous. Number four, she does not really need an oxygen because the saturation is 92 and this is normal for her age. The pulmo aid would be useful. She appears to have some secretion production that the nebulizer might help. And it's also good to idea to have the nebulizer because her inhaler technique is poor. The nebulizer would result in better inhaler medication and she might have better compliance. Oral suction is good to have the anchor, and there is no real indication for inhaled steroid. She is certainly not bad enough to go to hospital, so there is no need for admission. Miss Math's daughter, John, will be the primary caregiver. Which of the following should be taught? The cleaning procedure would be good to teach. Chest auscultation not recommended. Monitoring sputum for color changes is good. Medication side effect is good to teach. Suction technique, especially using the anchor from the mouth, is good to teach. 15 minutes later, you got an order to change the oxygen to 40% air entrainment mask. I think it's a good idea to perform your own assessment because the order is inappropriate. The patient is a CO2 retainer and should probably have the oxygen lowered. However, in order to confirm this, you should perform an assessment of the patient. 2 weeks later, the mismatch seems to be more dyspneic and less other, and you have been asked to do an assessment. Which of the following will be important to assess? It's a good idea to assess the saturation. The saturation was 80% on the 2 liter per minute from the concentrator. The general appearance was patient was very sleepy. The patient has been basically non-ambulatory, and the concentrator was, when checked, it has been giving only 40%. The pulmoid is working, the suction machine is working, and breath sounds decreased. The sputum suctioned from the mouth while was white and not too thick. So it's a good idea to really think about those to assess. On the basis of your assessment, you would do which of the following. I think a new concentrator should be obtained as soon as possible. Looks like the concentrator is not working appropriately. Thank you for listening, and this will end our case.